Hello, welcome to Vet Med Corner. I'm Dr. M. Today we are going to be talking about a difficult subject, behavioral euthanasia. This subject has come up because I was told about a video on YouTube by Nikki and NikkiPhillippi. So I did watch it and I have a number of thoughts for you. Join me and I hope that you'll learn something today. Alright, I wanted to start by discussing the fact that there is a bit of a taboo around behavioral euthanasia. People don't like to talk about it. It's uncomfortable. It is not a fun subject to talk about, but we do need to talk about it because it is something that more people than you realize end up experiencing and going through. And we do need to have space and compassion for the people that go through it. Now, to be very fair, I do not know everything about Nikki and Dan's situation and everything that they went through. However, watching their video, a bunch of stuff jumped out at me. Nikki and Dan mentioned that their dog was attacked by another dog as a young, or puppy, they said. Doesn't tell me exactly how old, but as a puppy, so a young dog. This is significant because dogs do go through a number of fear periods as they're growing up, and especially having a bad experience during one of those fear periods. The first one is usually, sometime around 6 to 8 months. They have another one around 18 months of age. Having bad experiences at those times can have an incredibly profound and lasting impact on the dog's life. Nikki and Dan mentioned that they took their dog to a dog park where this happened. That is one of the big reasons why I absolutely will never, ever, ever take my dog to dog parks. Every time I walk by them or drive by them, all I see is inappropriate dog behavior. There's a lot of bullying that goes on. There's a lot of bad interactions that are happening, and the people are doing nothing about it. I think mostly because they don't realize these interactions shouldn't be happening and that they're rude. Not only that, I have had to suture up and euthanize countless dogs that have gotten into fights at dog parks and have been very badly injured. Please don't go to dog parks. Don't go to them. Your dog doesn't need them. Your dog wants smelling enrichment mostly for most dogs. And so going on a long line and on a safari is a much, much, much better thing to do with your dog. The other concern about dog parks is just that they are absolutely a disgusting area for disease. It's incredibly easy to spread things like parvo and bordetella or kennel cough, fleas, intestinal parasites, etc., etc., etc. Just don't go to dog parks. Skip them, go somewhere else with your dog. The next thing that really jumped out at me when watching this video was that there are repeated incidents of this dog being incredibly dog reactive. They described the dog as being bipolar. Dogs are not bipolar. That is not a diagnosis that they have. What it sounds most like is that this dog was incredibly dog reactive. So what that means is there have been bad experiences in the dog's past. They now associate dogs with bad experiences, and as a result, some dogs will run away. Other dogs, though, instead of doing the flight response or the freeze response, they will do a fight response, and they will just immediately become the aggressor in an attempt to protect themselves from bad experiences happening again. It sounds like Bowser was a pretty severe case, to the point where he would injure himself whenever he heard or saw dogs, even through a fence, even, at a distance. There could also be some barrier frustration with the fence in there. There could be other factors going on. But the bottom line is that this dog had badly injured other dogs to the point where they needed sutures and significant veterinary intervention. This is a big issue, and it's not something that's just going to go away. This is something that if you are going through this with a dog, you immediately have to take significant steps at helping to change how this dog feels about other dogs. And the best way to do this is with a veterinary behaviorist. There are veterinarians that graduate vet school and then go on to do a residency in behavior. And those are the people that are best equipped to help you when you have a reactive dog, especially one that is this severe. If they are mildly reactive, you can sometimes get enough help from a positive reinforcement, research-based trainer who is good at behavior modification. You'll have to be careful trying to find someone with appropriate background and training for that. I'll link some things below, both to find a veterinary behaviorist and how to judge who is a positive reinforcement-based trainer. The reason why a veterinary behaviorist is so helpful in these cases is because they will help you with behavior modification plans. They can help with preventing your dog from seeing other dogs. They can help with plans how to do essentially a very gradual exposure. You need to start far enough away from another dog that your dog has zero reaction, and then you start building fluent behaviors of disengaging from that other dog and looking back at the human and being rewarded for that behavior. But the other thing that a veterinary behaviorist can help with is medication, and often prescription medication to reduce anxiety, fear, stress, all of those emotions is necessary for our dogs when they're this severely affected with dog reactivity. They need that medication help in order to be able to be in a frame of mind where you can change how they feel about the other dogs. You cannot approach this willy-nilly. It is a very specific, methodical, careful plan that needs to be implemented. Another aspect of the video by Nikki and her husband that jumped out at me was how people interacted with Bowser. They showed some photos that made me extremely upset and stressed feeling just looking at the photo. The people did not interact with this dog appropriately, period. There are photos of them grabbing his face and putting their face very close to his. That is a fantastic way to be bitten. Do not ever do that. Don't do it. I don't care how well you know the dog. I don't care how nice the dog is. This is rude behavior to do to a dog, and it should not be done, period. There were other photos that were also incredibly inappropriate interactions, people being too close to the dog, in the dog's space, the dog is stressed, and the people don't know. Having education for the people in this situation is something that apparently did not happen, and that is a hugely upsetting thing to me. This dog went through a lot of stress and suffering because the people didn't seem to know any better. I also wonder, but don't know, if punishment was used on this dog. This is the worst thing that can be done for a dog that's having fear-based aggression. If you punish these dogs, all that they learn is that when something happens that I'm scared of, bad things happen to me, which means that thing is definitely even more scary, and therefore their aggression just gets worse. You cannot punish these dogs. You need to remove them from scary situations. You need to reward them for behaviors that are good. You need to manage their environment. You need to teach them how to love wearing a muzzle. You need to use prescription medication to reduce their fear and stress. You need to learn how to interact properly with the dogs. Those are things that need to happen. And in this case, it doesn't seem like any of those things happened. The last thing that made me feel incredible amounts of stress looking at this video by Nikki and Dan was how they described their allowing their toddler to interact with their dog. Oh boy. Okay, they're describing cases of their kid pulling on their dog. They're describing cases of their child interrupting their dog when he's trying to rest and following him around, bothering the dog. This is not okay. This cannot be allowed to happen at all. ever. This is on the adults in this situation, and they should have done very, very different things here to manage this dog and the environment for the family. If your child is young enough that they do not know better, you must put barriers between your children and your dogs. Use baby gates. Give your dog an X pen. Tell your child when the dog is sleeping, you never go near the dog. And if the child goes to go near a sleeping dog, you need to pick up the child and move them and let the dog rest. It is incredibly appropriate for a dog to growl at a child when they are telling that child, I'm uncomfortable, you need to stop doing this. The fact that the dog felt it had to growl meant the people did not interrupt the child's bad behavior early enough. And that is on the adults. They need to be within arm's reach whenever the child has access to the dog and not doing anything else. This has to be for all dogs in all households. The main reason why children get bitten is because the adults are not doing a good job with managing the environment and supervising the child's interactions with the dog. The child bugs the dog, the child hurts the dog, and the dog reacts. That is not the dog's fault. This is the adult's fault for putting the dog in that situation. I'm sorry, this is a bit of a pet peeve of mine, so I'm getting a bit worked up here. Give me a minute. Okay, I'm back. I think I can talk about this calmly again. When you have young children and dogs and cats in the same household, you need to set up safe spaces for those animals to be where they will not be disturbed from the children. They need to have spaces where they can be on their own and have some peace and quiet. The animals need that, and that keeps the animals safe, and it also keeps the children safe. It's also incredibly important that you use barriers, that you use leashes and harnesses for the children or the dog, whatever you need to do to keep the child from bugging the dog. It's incredibly important from the get-go that you do not allow your children to pull on ears or tails or anywhere on the dog. You don't allow children to bother a dog while it's eating. You don't allow children to bother a dog while it's sleeping. Those things are not appropriate, and they need to be prevented however you need to set up your household to make it happen. Put the child in a crib. Put the dog in an X pen. There's lots of solutions, and those need to be implemented. And from this video, it sounds like none of those things occurred. They just expected the dog to tolerate being abused by the child, and that is not okay. And this especially upset me because it sounds like the dog had some health issues going on. What they were describing with the ear, that's called an oral hematoma, or most likely, and they're painful. And so to have your dog experiencing that, and it doesn't sound like it was getting any veterinary care or pain management, and then to allow the child to pull on that painful ear, that is awful, and that is not fair to the dog. I should also address what Nikki and Dan were talking about when mentioning calling the SPCA. The information that they were given is correct. If a dog has a history of multiple bites and it is rehomed, that bite liability for whatever happens in the future still falls on the original people who rehomed that dog, because they knew that dog was a significant bite risk and they rehomed the dog anyway. And for that reason, rescues and the SPCA will not take on dogs with this sort of history, and that is for good reason. It is for legal liability reasons. It is for safety for other dogs and people that the SPCA and the rescues work with. And so I fully support the SPCA and rescues for saying this to Nikki and Dan. They were correct, and rehoming this dog is not an appropriate option. And we know from the research done on dog bites that when they have a multiple bite history of this severity, the likelihood of them ever being trustworthy or rehabbed is incredibly low. And that's incredibly sad. And there's a likelihood that if Bowser had been raised appropriately, not taken to dog parks, if a bad incident had happened, immediately seeing a veterinary behaviorist and working with them intensively, having appropriate education on dog interactions from adults, prescription medication, behavior modification sessions, and all of that, it's possible that then Bowser could have lived a decent life. However, it's not guaranteed either. And so this is where the tricky part comes in. For this specific dog in this specific situation, I support euthanasia here. This dog was suffering. It was not having its needs met. It was not getting the resources that it needed to try to change how it felt about other dogs and about people. It was being interacted with incredibly poorly by all the people that it had in its household. It didn't seem like it was getting appropriate veterinary attention for the medical issues that it had going on. A humane end of suffering is not the wrong option here. That's tough to say. But our first obligation as veterinarians is to public health and safety. And the fact of the matter is that this dog was a risk to public safety. This dog was also a risk to any and all other animals that it came into contact with. And because of the severity of the bites and the number of the bites in this dog's history, the chance of it ever being considered safe to have a good quality of life again is incredibly low. And so I want this video to go out to people so that they can do better for their dogs. One of the major concerns that I had from Nikki and Dan's video was whether or not Bowser actually had any sort of an excellent quality of life. From what they're describing, he never got to go on snifaris. He rarely got to go for car rides. He would hurt himself getting so upset from just hearing or seeing another dog from a distance through a fence. He was not being interacted with appropriately with the humans in the household. When a dog has a poor quality of life, oftentimes euthanasia is the most appropriate answer here. And that is part of the reason why I'm not judging the fact that Bowser was euthanized. Is it awful that he had to be? Absolutely yes. Especially since it's possible that if he had been cared for properly, if he had lived with a household that interacted with him appropriately, if he had veterinary medical attention when he needed it, if he saw a veterinary behaviorist and worked intensively with them, it's possible that Bowser could still be with us. But those things didn't happen. That's the reality of it. And so I'm hoping with this video that I will help the other Bowsers to get the care that they need. Ignoring fear-based aggression and reactivity and just hoping it goes away is not the answer. Intensive, immediate intervention is what's needed for these cases. And so I want to get that information out there so that the next Bowser can have a chance. If you have a dog that is reactive, that is fearfully aggressive, that has had bad experiences, that has snapped at anybody, even if they haven't made contact, or definitely if they have actually bitten another living being, you must immediately see a veterinary behaviorist. You must. That is the first step. They will talk with you about how to appropriately train a dog to be happy wearing a muzzle, how to keep people and dogs as safe as possible, how to keep the stress and fear and anxiety that that dog is going through as low as possible, and that will likely include medication. If you don't do these things, your dog will get worse. That's what happens in these cases. Sometimes there is a lot of suffering that that dog is experiencing. Sometimes that dog does not have a good quality of life. Sometimes the chance of having that dog be safe for any people and animals it interacts with is low. And sometimes a humane ending of suffering with euthanasia is the best option. I don't like that fact. I wish it was not true. And I also know that there are many dogs that could have had good lives if only their people had had the information they needed to do a proper job. So this is my attempt to start getting that information out there. Please comment respectfully down below if you have something to add to this. Know that I do not judge people who choose euthanasia to end suffering, and neither do other veterinarians. That's part of our job. But it's complicated. Alright. We'll see you on the next one.